Prescription drugs can be a very helpful tool for someone suffering an injury or illness, but they can also have a devastating effect on individuals who misuse them. There is a disturbing trend in St. Clair County, and it has grown to such proportions that health leaders have established a prescription drug abuse task force. Research from the Office of National Drug Control Policy indicates that prescription drug abuse is the fastest growing drug problem in the United States, with a patient leaving a doctor's office with a prescription 7 out of 10 times they visit that doctor. When used as prescribed, these medications can be very beneficial. When misused, they can lead to overdoses, trips to the emergency room, and even death. What makes this scarier is the research also indicates there are many teens and young adults taking prescription drugs that are not intended for them. Consider these statistics. More than 25% of teens surveyed said they believe that prescription drugs can be a valuable tool as a study aid. More than half of the teens surveyed said it was easy to get prescription drugs right out of the family's medicine cabinet. And that same tally from the 2009 National Survey on Drug Use and Health indicated that about half of the parents said anyone can access their medicine cabinet. According to information from the National Centers for Injury Prevention and Control at the Centers for Disease Control, approximately 27,000 people died in 1 year in the U.S. of unintentional drug overdoses. That equates to 1 death every 19 minutes. In terms of prescription drugs, that amount of death rate has tripled in the last 10 years. According to the National Institute on Drug Abuse, there were just over 3 million new users of illicit drugs in 2011, or about 8,400 new users per day. Half of those people were under the age of 18, and 1/3, more than 30% of the first-time users were between the ages of 12 and 17. According to results from the 2010 National Survey on Drug Use and Health, an estimated 2.4 million Americans used prescription drugs non-medically for the first time within the past year. That averages approximately 6,600 new users per day. The Drug Abuse Warning Network, which monitors emergency department visits in selected areas across the nation, reported that approximately 1 million emergency visits in 2009 could be attributed to prescription drug abuse. Roughly 343,000 involved prescription opioid pain relievers, a rate more than double that of 5 years prior. Parents often talk to their children about the facts of life. And according to a tracking study from the Partnership for Drugfree.org, approximately 80% of the time, alcohol and marijuana were among the topics. However, only about 14 out of 100 kids said prescription drugs and painkillers were part of that discussion. According to data from Medline Plus from the National Institutes of Health, 20% of the children surveyed said they had abused prescription drugs before they turned 14. A growing number of teens report they have taken Ritalin or Adderall, even though it was not prescribed for them. 24% of teenagers across the country, more than 5 million kids, have abused prescription drugs. And in most cases, these are not from street corner sales. They're from the kids taking the pills from right in their own home. Another disturbing aspect of teens using prescription drugs and painkillers is the creation of what are called farming or bowling parties. At these parties, kids bring the pills they have taken from their parents' or grandparents' medicine cabinets, mix them in a bowl, and then take handfuls of the pills to ingest, not even knowing what they might be taking or if there is the potential for a dangerous reaction from different drugs being taken together. It's not just a problem among teens. Think about the office or workplace. Have you ever heard an employee offer a coworker a Vicodin, a Percocet, or other prescription drug? While the person offering that pill may think they're doing their coworker a favor, they could be placing them in a very dangerous position. Think about the last time you watched television or picked up a magazine. Other than auto company ads, what product do you frequently see or read about? Prescription drugs. They are touted as miracle-working products, and you are urged to talk to your healthcare provider about a drug that will supposedly improve your quality of life. If you listen closely or read the fine print, there are also a number of consequences and side effects that can occur. And if someone who the medicine is not prescribed for takes these drugs looking to get high or obtain some other effect, the results can be deadly. The medical community realizes there is a problem and are looking for alternatives to prescribing prescription painkillers. In many cases, when a person cannot get their prescription painkillers refilled, they begin doctor shopping. In many cases, the St. Clair County Sheriff's Department says if they can't find a refill, unfortunately, they turn to heroin, which is showing a growing resurgence in St. Clair County. Here is a partial list of the prescription drugs seized by the St. Clair County Drug Task Force in 2011. Are any of those in your medicine cabinet where anyone can get to them? Many people don't think abusing or misusing prescription drugs is as bad as using street drugs like marijuana, cocaine, crack, or heroin. But the statistics show a growing number of people needing emergency medical treatment or rehab because of the wrongful use of prescription drugs. Investigate ways to lock your medicine cabinet or secure drugs where only the appropriate people can access them. Furthermore, prescriptions that have passed their expiration date should be thrown away in a proper fashion. Contact your local law enforcement agency to inquire as to whether they have a secure facility where you can drop off unwanted, expired, or unused prescription drugs. It's time to talk to your kids about the dangers of misusing all drugs, including prescription drugs and painkillers. Many kids say it's easy to get their hands on their parents' or grandparents' prescriptions. So we all need to look at how we can prevent this growing trend from becoming an epidemic, or before we lose someone we love to addiction or worse. If you have questions, want to learn more, or are concerned about a situation, call your doctor, your local hospital, St. Clair County Community Mental Health, or the St. Clair County Health Department.